Isn't it a bit of a shock to think that when our furry family members get sick, it might not just be a cold or, a tummy ache? Sometimes infections can actually reach their heart and cause real trouble.
Absolutely, and that's exactly what we're diving into today. Myocarditis in dogs and cats.
Hmm.
We've gathered some pretty detailed medical info to help us understand this hidden threat, really, to their health.
Okay, so let's get right into it. What exactly is myocarditis? Lay it out for us.
Okay, simply put, it's an inflammation of the heart muscle itself. But what's really striking is just how many different things can trigger it.
Right.
We're talking infectious agents, viruses, bacteria, even fungi, and these tiny parasites called protozoa. And sometimes, believe it or not, certain medications can cause it too.
Wow, okay. That's a huge range.
It really is, and it highlights something important.
Mm-hmm.
Yeah, even infections that seem minor shouldn't always be dismissed because they can sometimes have these surprising, serious downstream effects on the heart.
That makes sense. So when this inflammation happens, does it hit the whole heart at once, or can it be more targeted?
That's a great question, and it's a really important distinction. The inflammation can affect different parts. It could be the actual heart muscle cells, the myocytes, think of them as the engine,
Gotcha.
or it could be the supporting tissue around them, the interstitium, kind of like the scaffolding. It can even involve the heart's own blood vessels, or that outer protective sac, the pericardium.
So it's not just one thing. The location of the inflammation really matters. Now, how does this actually happen? What's going on inside their body to cause this inflammation?
Well, there are a few different mechanisms. Sometimes the infectious agents themselves release toxins, poisons really, that directly damage or weaken those heart muscle cells.
Okay.
In other cases, the germs actually invade the heart tissue directly, and then there's the immune system.
Ah, right.
Yeah. While it's trying its best to fight off the infection, sometimes it can sort of overreact and end up damaging the heart tissue in the crossfire. A bit like friendly fire,
Yeah.
we can also see inflammation of the heart's blood vessels, just as part of a wider systemic illness. And finally, yeah, allergic reactions or direct toxic effects from certain drugs can also cause it.
That friendly fire analogy makes a lot of sense. The body trying to help, but maybe going a bit too far. You mentioned different types earlier. Can you give us an example of how a specific cause leads to a specific type?
Sure. So, for instance, there's a protozoan parasite called Trypanosoma cruzi. It can cause something called granulomatous myocarditis, where the immune system forms these little clusters, granulomas, trying to wall off the infection.
Interesting.
And with viruses, often it's the pet's own immune response attacking the heart cells that have been infected by the virus that causes a lot of the damage.
So the body's own defenses can really contribute to the problem sometimes. And this damage, can it be just in one little spot, or does it spread out more? I imagine that would change things quite a bit.
Exactly right. The damage can be focal, meaning it's contained in a small area, or it can be diffuse, affecting a much larger part of the heart muscle. Think of it like focal damage might be like a faulty wire causing one light to flicker, whereas diffuse damage is more like a major power surge affecting the whole house.
That's a good analogy.
And yeah, that difference directly impacts the symptoms we see. Widespread diffuse damage often weakens the heart significantly, potentially leading to congestive heart failure.
Right.
Whereas localized damage, especially if it hits the heart's electrical system, is more likely to cause arrhythmias, those irregular heartbeats.
That paints a really clear picture. So, moving on to who actually gets this, is myocarditis common? Or is it something pretty rare?
Generally speaking, viral myocarditis is considered rare. But, and this is important, it can be incredibly severe, especially in really young puppies, like in their first few months.
Oh, wow.
The main viruses we worry about there are things like parvovirus, distemper virus, the ones we vaccinate for,
Yeah.
and also herpes virus. And actually, with parvovirus, there's an interesting twist. There's a later onset form, maybe around 5 to 6 months of age, that can lead to a condition called dilated cardiomyopathy, which is a weakened, enlarged heart in dogs that were actually infected way back when they were tiny puppies.
Huh. So an early infection can have effects months later.
Exactly. It really underlines why knowing a puppy's early health history can sometimes be so important.
That's a really good point. What about those protozoal infections you mentioned before, like Trypanosoma cruzi?
Right. So Trypanosoma cruzi, which causes Chagas disease, that's been reported causing myocarditis, mainly in dogs under 2 years old, especially down in the southeastern U.S. And interestingly, it seems to affect males more often.
Okay. Any others?
Yeah, another protozoa, Toxoplasma gondii, can occasionally be a cause. And it's also worth noting that animals with weakened immune systems, think cats with feline leukemia virus, for example.
Yeah.
They're generally at higher risk for myocarditis from various infectious causes.
So a compromised immune system makes them more vulnerable. Makes sense. Are there other specific infections linked to it?
Yes, there's hepatozoon canis, which has been seen in dogs down in the Texas Gulf region. Fungal myocarditis usually pops up if there's already a widespread fungal infection in the body.
Right, it's secondary.
Exactly.
Hmm.
Bacterial myocarditis can happen with generalized sepsis, basically a bloodstream infection, and Lyme disease, caused by Borrelia burgdorferi. While it's known to affect the heart in people, it's actually less commonly proven to cause significant heart inflammation in dogs.
Interesting difference there.
And then, we can't forget the non-infectious cause, certain drugs. Doxorubicin, which is a chemotherapy drug, is probably the best known example in dogs, particularly at higher cumulative doses.
Okay, quite a list there. It really sounds like the risk depends a lot on what diseases are common in a specific area and the individual pet's health status. Does that mean geography plays a big role?
Well, yes and no. In essence, myocarditis that's linked to an infectious agent is a potential risk wherever that specific disease exists. So if Lyme disease is common where you live, the potential for Lyme-related heart issues exists, even if it's less common in dogs than humans.
Right, so it's tied to the presence of the cause, whatever that might be.
Precisely.
Now, we've talked about some age links, like young puppies with viral forms. Are there other specifics, like certain breeds or just dogs versus cats?
As we said, viral myocarditis definitely skews young, mostly animals under a year old, especially those very young pups. But beyond that specific type, myocarditis from all the other causes we've discussed can potentially affect both dogs and cats, really regardless of breed.
Okay, so apart from the very young ones and viruses, it's pretty broad.
Yeah.
Let's talk about warning signs. What might someone notice at home? What should you look out for?
The signs can be, well, they can be really variable. It depends so much on how much of the heart is inflamed and which part. It could range from something subtle, like an abnormal heartbeat that, frankly, an owner might not even detect, all the way up to really obvious signs of congestive heart failure.
Okay.
The key thing, the real red flag, is often the timing. Seeing new heart-related symptoms pop up around the same time the pet seems generally unwell, or maybe after starting a new medication. That connection is really important.
So it's often linked to something else going on. What are some of those more obvious signs an owner could spot?
Okay, things to watch for would be coughing, any difficulty breathing, maybe they just seem really tired, less tolerant of exercise than usual.
Right.
You might also see episodes of fainting or sudden weakness that could definitely point towards an arrhythmia and irregular heartbeat.
Mm-hmm.
And like we said, if these things happen alongside other signs of illness, like a fever, being really lethargic, or if you know your pet has recently started certain meds, that's definitely cause for a vet visit.
Absolutely. Those are clear warning signals. And what might the vet pick up on during their physical exam?
Well, listening to the heart, the vet might hear abnormal sounds, maybe a gallop rhythm, which is an extra heart sound, or a heart murmur. Though it's important to say that's not always present. It depends on the damage.
Okay.
They might also feel an irregular pulse when checking the heartbeat. And, of course, if there's an active infection driving the myocarditis, the pet might well have a fever.
So the vet's exam provides more clues. Let's circle back to the culprits for a moment. Can you give us a kind of quick reference list of those main infectious agents again, just to consolidate?
Sure. Okay. Key viruses: parvovirus, distemper, herpes virus, West Nile,
Got it.
key protozoa, Trypanosoma cruzi, Toxoplasma gondii, Neospora canatum, Hepatozoon canis, Babesia species, Leishmania species,
Okay.
bacteria, Bartonella is one to note,
Mm-hmm.
fungi, Cryptococcus, coccidioides, valley fever fungus, Blastomyces, Aspergillus,
Right?
and even algae, believe it or not, Prototheca.
Mm.
And then the non-infectious one we mentioned, the drug doxorubicin.
That's quite the lineup. It's helpful to have them listed out, though. For owners, focusing on the ones we vaccinate against, like parvo and distemper, seems like a key preventative step, right?
Absolutely. Vaccination is crucial for preventing some of the most common and severe viral causes.
So we know the potential causes. What makes one pet more likely to develop myocarditis than another if they are exposed? What are the main risk factors?
Well, the biggest one is obvious, actually being exposed to one of those infectious agents.
Naturally.
Then there's the use of drugs known to have heart toxicity potential, like doxorubicin. Having a weakened immune system, maybe from another illness or medication, definitely makes them more susceptible. And sometimes just having other underlying health issues can increase the risk too.
Okay, that lines up. So let's say a vet suspects myocarditis based on the signs and history. How do they actually confirm it? It sounds like it could be tricky to pin down.
It really can be. A definitive diagnosis can be challenging. So the first step is often ruling out other things that could cause similar signs. That's what we call differential diagnosis.
Right. Like what?
Vets will think about congenital heart defects problems they were born with, or other kinds of acquired heart muscle diseases, maybe issues with the heart valves. Knowing if the pet had any heart issues before this current illness started is a really important clue.
Ah, the history.
Exactly.
Yeah.
And also, if there are clear signs of infection elsewhere in the body, or if other organs seem involved, that pushes myocarditis higher up the list of possibilities for the heart problems.
That makes sense. It sounds like putting pieces together. What about lab tests? Can blood work or other samples help?
Oh, definitely. Lab tests are a huge help. Standard blood counts and chemistry panels, plus urine tests, can show abnormalities related to other organ damage or just the body's general response to inflammation or infection.
Okay.
There are specific blood tests, serologic tests, that look for antibodies or antigens related to certain infectious agents that can help pinpoint a cause. If there's fluid buildup, say around the heart or in the chest, analyzing a sample of that fluid can sometimes reveal the infectious organisms. Blood cultures can check if bacteria are circulating in the bloodstream. And importantly, there's a blood test for cardiac troponin.
Troponin.
Yeah, it's a protein that gets released from damaged heart muscle cells.
Uh,
So if the levels are high in the blood, it's a strong indicator of heart muscle injury, which you'd expect with myocarditis.
that sounds like a really useful marker. What about looking at the heart directly with imaging, x-rays, ultrasound?
Absolutely critical. Chest x-rays or radiographs can show if the heart looks enlarged overall or if there's fluid in the lungs, which suggests heart failure.
Right.
But the echocardiogram, that's the ultrasound of the heart, is often even more revealing. It lets us actually see the heart muscle working. We can assess how thick the walls are, how well it's contracting, look for damage, see if there's fluid around the heart sac or if the sac itself looks thickened. Sometimes you can even see specific areas of the heart wall that aren't moving normally if the damage is localized.
Wow, so it gives a really detailed picture.
It really does. Angiography, using dye to see blood flow, is technically possible, but honestly, echo is so good these days, it's rarely needed for this.
So echo is the go-to for imaging. Are there other procedures sometimes needed for diagnosis?
Yes, definitely. An ECG, electrocardiogram, is vital for looking at the heart's electrical activity. It can show patterns suggesting heart chamber enlargement, and crucially, it identifies any arrhythmias beats that are too fast, too slow, or irregular, and where they're coming from. It also helps find problems with the conduction of the electrical signals through the heart.
Okay, checking the electrics.
Exactly. In some select cases, particularly if you're trying hard to identify a specific infectious cause, an endomyocardial biopsy might be considered.
Yeah.
That involves taking a tiny, tiny sample of the heart muscle itself to examine under a microscope.
Wow, that sounds invasive.
It is, which is why it's not routine. If there's significant fluid buildup around the heart, called pericardial effusion, doing a pericardiocentesis, draining that fluid with a needle, can be both diagnostic, you can test the fluid,
Yeah.
and therapeutic, it relieves pressure. And finally, if arrhythmias are suspected, but maybe aren't happening constantly, a Holter monitor can be used. That's basically a portable ECG the pet wears for 24 hours or so to catch those intermittent rhythm problems and also to track how well treatments are working later on.
So quite a few tools in the diagnostic toolkit. If you were able to look at the heart tissue directly, say during a biopsy or maybe after an animal passes away, what would you actually see?
Pathologically, on a sort of gross level, looking with the naked eye, the heart chambers might look dilated, bigger than normal. You might see patchy areas of redness indicating inflammation or even areas of dead tissue, necrosis or scarring, fibrosis. Sometimes those little inflammatory nodules, the granulomas we mentioned with T. cruzi, might be visible.
And under the microscope.
Microscopically, you'd expect to see inflammatory cells infiltrating the heart muscle or the pericardium. You'd likely see evidence of cell damage or death and scarring. And sometimes, if you're lucky, you might actually see the infectious organisms, bacteria, fungi, protozoa right there in the tissue. In cases caused by drugs like doxorubicin, you might see a loss of the actual heart muscle fibers.
That microscopic view sounds like it could really tell the story.
It often does, yes.
Okay, let's shift gears to treatment. If a pet is diagnosed with myocarditis, what's the general approach? What happens first?
A lot depends on how sick the pet is. The initial focus is often supportive care. If they're showing signs of congestive heart failure, difficulty breathing, fluid buildup, they'll almost certainly need to be hospitalized.
Okay.
They'll need medications, maybe oxygen therapy just to get them stable. Same goes if they have severe life-threatening arrhythmias. Hospitalization is needed to start antiarrhythmic drugs safely. And if the underlying cause is making them really sick systemically, they might need intensive hospital care.
Makes sense. Stabilization first.
Absolutely. And one really crucial thing, regardless of severity, is strict rest. Minimizing any strain on that inflamed heart is vital. Diet-wise, if heart failure is present, limiting sodium intake is usually recommended.
And what are the key things for owners to understand during this process? What do you make sure they know?
That's critical. We need to explain that even if the underlying infection, say, is successfully treated, the heart damage and related problems might persist long-term.
Right, the damage might be done.
Exactly. Also, owners need to understand that some arrhythmias, especially certain types of ventricular tachycardia, very fast rhythms from the bottom chambers, can be life-threatening, needing prompt and ongoing management. We also have to be honest that getting a totally definitive cause while the animal is alive isn't always possible.
That must be frustrating.
It can be. And finally, there's the public health aspect. If the cause is something like toxoplasma or trypanosoma cruzi, we need to discuss the potential, albeit usually low, risk to human health and necessary precautions.
That's a really important, maybe often overlooked point. You mentioned supportive care and rest. Are there any surgical options?
Generally, surgery isn't a primary treatment for the inflammation itself. However, in very specific, rare cases where the myocarditis causes a complete heart block, meaning the electrical signal from the top to the bottom chambers is totally blocked, a permanent pacemaker might need to be surgically implanted to maintain a proper heart rate.
Okay, so only for specific electrical complications. What about medications? What are the main types of drugs used?
The medication strategy really has two main arms. First, treat the underlying cause if you can identify it and if it's treatable. So antibiotics for bacterial infections, antifungals for fungal infections, specific antiparasitics for certain protozoa.
Makes sense. Target the trigger.
Right. The second arm is managing the consequences, the heart problems themselves. Antiarrhythmic drugs are used to control abnormal heart rhythms, and the choice depends entirely on the specific type of arrhythmia. If there's congestive heart failure, then drugs like furosemide, a diuretic to remove fluid, ACE inhibitors like enalapril to help blood vessels relax, and drugs to help the heart contract better like pimobendan or sometimes digoxin are used.
Okay, a multi-pronged approach. Are there ever situations where, unfortunately, treating the animal isn't recommended?
Yes, sadly there can be. As we touched on, with certain zoonotic diseases, those transmissible to humans like trypanosoma cruzi, if the public health risk is deemed significant, treatment of the infected animal might be discouraged or even contraindicated in some regions or situations.
Wow, that's a really tough ethical consideration.
It truly is a very difficult balance between animal welfare and public health.
When vets are using these medications, especially the heart drugs, are there particular precautions they need to take?
Absolutely. Antiarrhythmic drugs can be tricky. Sometimes, paradoxically, they can actually worsen arrhythmias or cause new ones. So, careful monitoring, often with repeat ECGs, is essential when starting or adjusting these meds.
Okay.
Also, if the pet has other organ problems, like kidney disease, which can happen with systemic infections, dosages of various drugs might need to be adjusted carefully. Close monitoring of kidney function and overall health is crucial.
So lots of careful monitoring. What does the follow-up care typically involve after they hopefully go home?
Follow-up is key for myocarditis cases.
Mm-hmm.
It usually involves regular recheck exams, including listening to the heart and checking their overall status. Repeat ECGs are often needed, especially if they're on antiarrhythmics, to make sure the heart rhythm is controlled.
Right.
Repeat blood tests might be done to monitor infection levels or check for medication side effects. If they were treated for heart failure, follow-up chest x-rays are common to monitor fluid levels, and general blood work helps track overall health and organ function.
It sounds like ongoing management is often required. Lastly, thinking about prevention. What can pet owners actually do to try and avoid myocarditis in their pets?
Well, direct prevention of the inflammation itself is hard, but you can definitely reduce the risk by tackling the causes. Number one is keeping vaccinations up to date. That protects against major viral causes like parvo and distemper.
Crucial.
Trying to avoid exposure to known infectious agents helps too. So good parasite control, maybe avoiding areas known for high rates of certain tick-borne or fungal diseases if possible. And for pets receiving drugs like doxorubicin, Proactive monitoring of heart function with ECGs and echocardiograms during the treatment course is standard practice to catch any problems early.
That all seems like very practical advice. So bringing this all together,
Huh.
what's the general outlook if a pet gets myocarditis? What's the prognosis typically like?
It really, really varies. The prognosis depends heavily on the underlying cause, how much heart muscle is damaged, and how severe the clinical signs are, especially heart failure or serious arrhythmias. Unfortunately, many of the systemic fungal and protozoal infections that cause myocarditis carry a poor prognosis overall, as they are difficult to treat effectively. Pets who develop significant heart muscle damage, leading to overt congestive heart failure, generally have a guarded to poor outlook.
That's tough to hear.
It is. However, if the myocarditis mainly causes isolated arrhythmias that can be successfully managed with medication, and if the underlying cause, like a bacterial infection, can be found and effectively treated, the prognosis can be better, potentially even good.
So it really hinges on the specifics of the case. Okay, let's try to summarize the key message here. What's the main thing you want people listening to take away from this deep dive?
I think the most important takeaway is that myocarditis is a serious condition where the heart muscle gets inflamed, very often because of an infection somewhere else in the body, or sometimes due to medications.
Hmm.
Understanding the wide range of potential causes, being aware of the signs, both subtle and obvious, and knowing how vets approach diagnosis, that's all crucial for catching it early and getting the right care started.
Absolutely. It really underscores how important it is to be observant as a pet owner, doesn't it? Noticing changes, especially when they happen alongside other signs of illness, and getting veterinary help promptly, it sounds like being proactive is really the name of the game.
It really is. And maybe a final thought to leave people with, given this huge variety of causes, from common viruses to fungi to protozoa, what does this tell us about how interconnected a pet's general health is with their heart health? And maybe what other questions should we be asking about prevention, thinking about their environment and overall wellness?